Welcome to our lunch and learn session for today, which is about using video call technology for telehealth and specifically using Healthdirect Video Call. Got sort of introduced at the beginning of the pandemic, March 2020. They brought in the first COVID-19 telehealth MBS items. They've made lots of changes in the meantime. The most recent changes which happened on the 1st of July, and that has led to an emphasis on video conferencing. So previously you could do a lot by the telephone. You can still do some by the telephone, but a lot of them now require video conferencing. So hence we're trying to really support practices with that. Of course, those requirements change again all the time. When I did this webinar or a similar webinar 2 weeks ago, it was the day they just brought back one of the telephone numbers for Sydney because of the current outbreak. But yeah, check that link. That should be where you can always find the most up-to-date information. And again, you can always contact us. So I'm going to hand over now to Jude. We're joined today. We're very pleased to have Jude. Jude is one of the video call customer engagement officers from Healthdirect Australia, and she knows all about Healthdirect Video Call, and she can help us navigate it, use it to the best ability. And I'll hand over to Jude. Thank you very much.
Thank you. Thanks, Nerida. So yes, I am the video call customer engagement officer at Video Call. At Healthdirect Video Call. I'm not sure, I'm just having a look at the list of attendees here. I'm not sure, I think there's a bit of a mix of people that would be familiar with Healthdirect Video Call and some that might not be. So I'll go through a bit of an overview first, and then I will do a bit of a demo. So we'll just see what we've got time for, and I'll probably need to get a wind up by somebody at some point because I'll get right into it. So what I'll do is I'll just share my screen. And you can just let me know that that is sharing.
Yeah, I can see that now. That's good.
Perfect. Okay. So I'm just going to go through an overview and just a little bit of information. I won't go over those MBS items, but that's really great that you've mentioned those. Oh, my pointer's not working. Let's go here. So first of all, if you're not aware of video call, I'll just give a brief overview. So we've been actually going since it first started in 2014, sort of got going in 2014-15. And so there's been a bit of a history with Healthdirect Video Call for quite a while. But of course, when the pandemic hit, and you know, it was gradually increasing in numbers, more people were using our service. And when the pandemic hit, obviously, there was a lot more. And so we'll talk about that and the usage in a moment. But just with video calls, so there are obviously various video conferencing platforms around, and you'd be familiar with some of them, and we're obviously using Zoom at the moment. What Healthdirect Video Call is, though, is purposely built specific for health consultations, and it doesn't have a middle kind of conferencing unit or software like a Zoom or a Teams or something that can actually record or store any of the information. It is browser, so an internet browser like Chrome or Edge or various browsers that we support directly, when you're in a video call, directly with another person's browser. And it uses a thing called WebRTC, which I won't go into, but what it is it's extremely secure because it's all fully encrypted. So nobody who shouldn't be seeing any of the information in a call can actually understand what it is, even if they did manage to. So it's all very secure. And we work on a virtual waiting area dashboard model. So just like a GP practice or any clinic, physical clinic, you send out information to people about their appointment, and then they come and arrive they turn up in your waiting area. It's the same model here. So basically what you do is you send out your information, and I'll show you how to do this afterwards. You send out your patient information about when the appointment is, what time, which doctor, and include a clinic link. And every clinic in our platform has its own link. And that is the link that the patients or callers or clients call in through. They click on that, put in their name and phone number and anything else that's configured by the clinic, like their date of birth or Medicare, if that's appropriate. And then they arrive in the clinic waiting area. And when I go in and sign in a moment, you'll be able to see that. And then they're joined by their service provider. So that's the model that we work on. You don't need, people often ask us about what sort of equipment they're going to need. You do need a camera and a microphone attached to whichever device you're using. You can use a phone, a tablet, a computer, as long as it can connect to the internet and has a camera and a microphone attached. It can be an inbuilt or a USB or, you know, however it's connected. And then you just need an internet connection. So it can be a Wi-Fi, Ethernet connection, or a 4G if you're using your phone or tablet. So you don't need anything else, and you don't need, if you're doing your consultations one day on a computer and you need to do them on your tablet the next day, you don't need to download anything. You just need to sign in, and you'll see exactly the same dashboard. So we'll talk about getting an account in a moment, but as an account holder, you need to kind of set up an account as a doctor, a nurse, a practice manager, whoever you are in the team. As long as you've been invited to join the team by your clinic administrator or telehealth manager, then you get a link to create an account, and I'll show you that in a moment. Patients don't need an account, so they just get a link that you've given them, put in their details, and arrive in the waiting area. So it's very simple for them. I talked about the encrypted connections before, and just to reiterate, no patient or personal health information is stored by Healthdirect Video Call. At the end of a call, all that information is purged. And we're government funded, so free to use for eligible health services and their patients. So I'll just go on to the next slide. So the eligibility, we're 100% government funded. The Commonwealth is funding the programs that we would be interested in here today, the PHN programs. So there's a COVID-19 GP access, and that is until the 31st of December 2021 currently. We're waiting to hear what more permanency we have beyond that. And so GPs can sign up, and it's free. So it's free to get your account. It's free to get your clinic set up, and any of the training that we also provide, anything through Healthdirect, is free because we are fully 100% government funded, so we're not for profit. If you're not in a GP practice, there is also the PHN Exemplar program, which is now running until the 30th of June 2022, and that's for non-GP primary care services. And it's got here classed as mental health, aged care, maternity, Indigenous health, and allied health services. We've got a little bit of a list, and people contact us and we can let them know whether they're eligible. And if you're eligible, then you can get a free account also. I won't talk about the MBS stuff at the moment. I don't know if anybody asks questions or anything like that. I presume someone else is actually monitoring those, but just let me know because I can't see anything coming up at the moment. Yeah.
That's fine, Jude. I'll manage that, but we'll probably do questions and answers at the end. I should have said that.
Sure.
But yeah, generally we'll let you run through in case you're going to cover what people might be wondering about, and then they can answer at the end.
Cool. Thank you. All right, so this is just a quick little, snapshot since the 1st of July. So this is since the 1st of July, this past month. And obviously Sydney has been in lockdown and now is in more extended lockdown. So GP clinics added to our platform from the 1st of July 2021. So these are all the PHNs, and you'll be able, and you can see here, Central and Eastern Sydney PHN has done really well. There's a couple of other PHNs that have done a lot of onboarding as well, and these are in New South Wales, and these are all the PHNs. So you can see here that we've added 291 new clinics since the 1st of July to video call, and these are GP clinics only. There's a lot more in other practices as well. And now I never know how to say it, CESPHN. I heard you say CESPHN before. In this PHN, we've got 47 added. So 47 new clinics in the last month, and there was already quite a bit of activity there as well. So that's great. And we're around to help onboard anybody. I know Nerida and the team there can also add clinics, and if people contact us, we can do it as well. So we've got a support team at Healthdirect Video Call, and we've also got a resource centre library. So when you're got your video call account, you can always look up anything you like in our resource centre, which you can search. And I will we'll organise to kind of give you the URLs for those as well. So we provide a lot of support. We've got articles in here, videos, how-to videos, and we do also do quite a bit of training. So with this account set up, if you haven't got an account, I'll just go through this really quickly before we do a demo. So if your clinic is set up with video call already and you want an account, say you're a doctor in the team and you haven't been added yet, you can ask your clinic administrator. It's usually the practice manager who sets up the virtual clinic in video call, and then they're added as an administrator. If you're not sure who to contact or who your telehealth manager is, you can always contact us on our contact details for our support team, and we can give you the details that you need. So you just need to get in touch with someone in your team or your organisation that has the role of an administrator, and they can add you. When they add you, you get an email. So this is just a bit of a snapshot. You'll receive an email to create your account, and you click on create your account here. Gives you a little bit of information as well, and a video tells you where to go for training. So that's really handy. You have those links there, and you click on create your account, and you'll come to a page like this where it says, please fill in your name. Now your name will be linked to your account, which is your email address. So each person who gets set up in video call is known by their email address, and we do recommend that everybody gets their own account. It can be a work email address or it can be a private email address. It doesn't, a personal one. It doesn't matter to video call, but that's how we'll recognize you and find you in the system. You put your name in, and that's what people will see when you're in a video call with them. You can put just your full name, or you could put doctor and then your name, however you want to be seen in the screen. It's just a little in the corner, it shows your name, but nothing else. It doesn't show your email address. There's no information that your patients can see about you apart from that. They can obviously see your face. So you put your name in, password, confirm a password. Now, it is 13 characters or more. Because we are 100% government funded, it's extremely secure, and we follow all the government regulations, and 13 characters is what we've been asked to do. So I usually think of a passphrase so I can remember what it is. And then you would click create account here, and when you click create account, you'll be taken in to the clinic you've been invited to, and you can sign in. I'll go through this integration a little bit later if we have time, actually. So this is our sign-in page. And what I'll do is I'll just switch over to Chrome, and this is our live sign-in page. So once you've got your account, you come here and you sign in, and you can bookmark this page. So at the top of the page here, having problems with my mouse again, disappearing. It's vcc.healthdirect.org.au login, and you'll be able to get in here. So I'm just going to use an account here. Ah, there it is. Okay. I might just use one that just takes me into this one particular clinic, as if I'm, actually that's not the one. As if I'm a doctor in, okay, there should be one that says new. There we go. So I'm going to click next, and I'm going to come in. So this particular account that I've set up for myself only has one clinic, and that's often the case for, say you're a GP in a practice and there's one clinic set up, you don't have access to more than one, so you'll be able to see what it'll look like for yourself. I've checked this keep me signed in for today, so it'll keep it open for 8 hours once I've signed in, and if there's any periods of inactivity, it won't log me out, and then I will log in. Here I am. So now I am in my waiting area dashboard. So this is, I remember I talked about the waiting area model. This is your online waiting area, and this is the dashboard that signed in users see. So you may have, say, 5 doctors in your practice, or if it's not a practice, allied health professionals, and you might have a couple of nurses and receptionists. Whoever you've got, you can give them all accounts, and everybody can see this waiting area. So just be aware that video call is not a booking service because we don't keep any patient information. We can integrate with booking services though with the clinic link, and I'll show you that in a moment. So I've got somebody waiting here. Now, Nerida, you were going to come into this clinic?
Yep, sure, I can do that now.
Thank you.
Waiting, I'll do
okay.
so.
No worries. Okay, so I've got one of my other colleagues has come in here. I'm not going to join a call with her though. So I've got someone waiting. So this is just showing that there could be a patient and that patient is waiting, and it shows me their name. Now, because video call is not a booking system, when you sign in here, if you've got a very busy practice and you're using lots of video calls, you might see quite a few calls here and it'll say join call next to them all. You just need, there you are. You just need to use your usual booking software to know who your next patient is, just as you do when you call them out in a physical waiting area and they come from the waiting area into your room. So Nerida's just come in, so that's great. Now, I'll just talk quickly about these things on the right-hand side before I join a call. So you can do a little pre-call test that tests your network and equipment. You just really need to do that once to make sure you've got everything set up correctly. And that's just there in case you need to use it. I won't go through the other things under here at the moment, but what I will show you is this really important part here. Share the link to your waiting area. So this is your link you send to patients. And it's actually formatted in quite a short URL form, so it's quite easy. It's not a really long link unless you have a super long clinic name, but your clinic admin can actually shorten that in the URL or the web link. So this is my link. So I can copy that link and I could paste that into practice management software. That's one way that you can integrate. So say I copy that link and I've got a template set up in whatever practice management software I'm using. I could set up a video call template so that anyone who's being invited to a video call would, I could use that template and just change the patient name and the time of the appointment and everything. And then I would include this link. So this is the link and I would paste it in there because that's what they need to begin the video call. And I'll just show you, this is a page in our resource center. I'll just jump here for a minute. This is one of the pages that we've got, and it tells you how, that you can get the clinic link. And an example of practice admin software page where it's setting up templates, and you can create one in here and put the link. We've also got on this page some examples if you're using any of these. But there's also templates that you can use as well. So if I click on this page, there's little templates that we've put together. For example, if you want to send something out, this could be the wording that you could use. And that's just suggested. So you can get in contact with us for information about that. But it's all available to you. So you could copy the link, put it into your practice management software and use everything from there, or you could copy it into an email, the receptionist email address, and send out the patient information that way. You can also send an email or an SMS directly from the platform. So if you click select email, send email, put the email address in, you can change any of this text and then the link will be added at the end and you send the email, or you send an SMS, which is what I just did to Nerida to get her in. I put her phone number in here and then she's got the link and you can just tap on it on her phone. This, once again, you might need to use the suggested, or you can make up your own template because it always defaults back to this. And if you do want to change it, you can cut and paste in here each time. That's sending it directly from the platform. You don't have to do that. You can send it however you like. If I copy the link, I'm just going to show you what it looks like for your user, so your patient. So I'll click in here just as if I've clicked on that link, and it looks like this. So they don't need an account. It comes to this page, tells them which clinic they've got an appointment with, and they start the call. So if I put my name in here and then a phone number, then I too, and continue. I look at the important information that I need to read before I come into the clinic, and now I'm waiting. So now you'll see, there I am. So that's how I get in. It's really quick. They just need to put in their information, and then you know who's waiting and you can join the appropriate caller. So I'll just join Nerida. Before I do that, I'm just going to leave the waiting area in this one because my machine's doing way too many things. I've got someone else waiting here as well, but that was just to show you the journey. So Nerida, I'm going to join you, and the way that I do that is I join call. So I can see along here who's waiting, how long they've been waiting for, their phone number if I need it, and that's all going to be purged at the end of the call, and I will join the call. So in this clinic, we've set up, the clinic administrator can set this up. This can be turned on or off. We've turned it on in this clinic, a little confirmation box. So when I click on join call, it says I'm about to join with the following people. And if I've mistakenly clicked the wrong person, it will alert me here. But this is who I wanted to join with, so I will click join, and then the video call screen opens in a new screen. I'll just mute myself there, Nerida, so you can't hear me twice. And I will just mute you there. So now you can see us. So I'm the signed in user here, and there's Nerida who's being the patient. Yep. And at its simplest, now I have the video consultation. We can see and hear one another, and we have a chat, and we have our consultation. So they're the basics of getting into a video call. I'll just quickly show you, what time are we at? How much time do I have left? Oh, hang on, when would you like me to go till? 10 more minutes, perfect. All right, thank you. All right, and then we can have questions after that. So these are the two screens. If I go up here where it says tools, people often ask us, how do I do a screen share or something like that? They're all in tools. So in video call, they're called tools, and you can see them all listed down here on the right-hand side. And so I'll just quickly share a couple of things, but if it's a screen share and you want to share a screen, I've got two screens today. Entire screen will tell you which one do you want to share, and then that will share into the call and appear here. Or whichever window I've got open. I've got PowerPoint and Chrome open at the moment, or a tab. So you've got options along here to share a screen. I won't share a screen at the moment, but I will share something. So let me just click on here. Once you click on here, it'll take you to your computer and you can decide what you want to share. So I'm going to say, I'm going to share this finger x-ray with Nerida, and she should be able to see that as well. Yep. So, and I can talk through that, or perhaps it's a result, or perhaps it's some other image, if appropriate. What you can do with these also is there's a little toolbar that comes up at the top, and you can annotate over the top and say, oh, you've done a bit of damage there, and look, this. So I've just gone, there's little highlighters, there's a pen, you can type. Just to give some annotations over the top to help your patient, understand what you're talking about. Then you can, and your patient at this stage can download that. So they've got a little download button as well, and you could say, oh, look, download that so you can remember what we've talked about today. If they share something with you, likewise, you can download it before the call ends and put it in their patient records, because at the end of the call, you won't be able to get hold of it afterwards, because remember, we get rid of anything to do with the patient information. So I'll just click download. Because it's something that I initially shared a picture, there's the original document, but then I did some annotations over the top so I could save it either way. And then when I click save, it'll go wherever my downloads go. So there's that, and there's other things as well. You can start a screen share, as I said before. You can add a whiteboard. Some people like to do diagrams for people. I won't do it. I'm really bad at them. But anyway, pretend this is sort of some kind of, it's meant to be a knee joint. Say something, and then I would write something here. I do a little diagram, and then they can download that to help them with a greater understanding of what you've been talking about. Some people like those. You don't have to use them. They're just there as a tool. And then you can see two things are currently being shared. So if I go back here to tools, I could share another one. If I close this document, I'll just see my patient again, and I could close this as well, but they're still there available if I want to come back to either of those. I can delete them with the rubbish bin, but they get deleted at the end of the call anyway. So it's really, you can do that, but otherwise it's really easy to just close it up. And you'll notice there's a couple of other things along here. There is a chat function, so I could type something in here. Perhaps if it was a link or difficult to spell medicine name or something. Obviously, you're talking to them, but you have got a chat function if you'd like. And the only other thing here is the call manager, where I can open this up as the signed in user. So Nerida won't see this at the moment because she's coming with a patient link. She doesn't have a call manager. Only account holders do. And it says, welcome to your call manager. So I can see who the participants are. I can invite somebody else into this, directly into this call. So if there was another person like a carer or anybody else that I would like to come in, a parent, perhaps a specialist I could invite into this call. And I'd just click here, put their name in, and that's what will appear as their name when they arrive in the call. And once again, I can send an email or an SMS. I'd put in their phone number and I would invite, and it would send the link. But this time, let's pretend we just sent that. This time it's a link directly into this call, so they don't go into the waiting area and wait. They come straight in here. As soon as they click on that link and accept it, they'll come into the call and we'll be able to see them. And then it will be with 3 people. And you can have up to 5 people currently in a video call with good video. And we're working on getting a lot more participants. That's on our roadmap. So there, that's inviting a participant in. And just lastly, what I'll show you is you can, in this call, you can see up here, I'm in a tab. There's also still my waiting area dashboard. So I can tab between these two. It opens in a new window. So if I go back, it now shows me that this is my call, because that's the one I joined. It said join call before I joined, and now there's 2 people in it. And you can click on here and you can see who the participants are, me and Nerida. And it gives me information about our bandwidth and what device we're using. So there we go. That's great. So I can see that Nerida's using the Safari browser. Just in case there's anything that you need to troubleshoot, but usually you don't need to go in here. So my call. Now you notice the other one, the other person that's waiting now says add to call, because I'm currently in a call. So anybody else waiting down here, if there's 2 or 10 more people waiting, they'll all say add to call. And obviously, if I've invited Jenna to come into the waiting area, perhaps she's the interpreter, then I could add to the call if appropriate. So there's 2 ways you can get somebody in. You can get them to come into the waiting area and then you can go and get them and add to the call, or you can invite straight in as we did before. And I've just got a little lock button here. So that locks the call. Now if I go back to the waiting area, it just stops any other signed in user, any of your team members accidentally clicking on your call that you're already in and joining it. It's grayed out. So they're the basics. And I just wonder if we've got, while we've got this window open, if we want to see if there's any questions. I can see that something.
There is a question. I'm not sure if you can hear me through the,
yes,
I don't know where you're hearing me, but anyway.
I can hear you.
There was certainly a question about where are the tools. So that's, you can explain that, but it's when we're in, only when you're in this live call that you can see the tools, but Jude will show again.
Yep.
I guess.
Yep. Is there anything else?
Someone's, oh, okay, about user rooms. So one of the participants has actually been inviting the patient into their user room directly rather than into the waiting room. And the question is just about, is there benefit of one versus the other?
That's a really good question. I'm glad somebody asked that. The first one is tools. So here I am in my live call. So it's not obviously when you're looking at the waiting area, because you're in a call, but you're not on the right screen there. So once you join a call, you will see this tools come up. This one's been configured. They're usually a blue color, but we've just configured this in one of our sessions and it's gone to branded a little bit and it's gone orange. You just click on tools and then you will see them. Now, one thing I didn't mention with the tools, and you just click on the one you want and go through whatever you like. If you've got a YouTube link, for example, you could put a YouTube link in here and then a YouTube video would embed in here and the other person would be able to see and hear if you want to, watch a video together or a segment, a little bit of a video. So there's all sorts of things you can do. What I didn't say before is there's a little checkbox here that says make tools view only for guests. So if you want to be able to share things with people, but you don't want them to be able to kind of annotate over the top or download them using video call, then you can click this and now the other person shouldn't be able to see the tools menu and they can't share with you. Basically what they can do is just view things that you share. So it's up to you. By default, that's off and they can share things with you and they can download, but you can click that if that's appropriate. The other thing is user rooms. So when I go back here, The reason we can't see any user rooms in this clinic is that we do tell people usually, and in all my training, I tell people to please turn them off because it gets a little bit confusing about what they are. So the waiting area is designed to get your patients in here, and you use your clinic link, and that's how you can integrate that with your practice software, and you've got much more functionality here. So when they're waiting, you can see the information here. You can also notify them while they're waiting if the clinic's running late. The receptionist could do this, for example. So they could click on notify and say, sorry, the doctor's running, you know, sorry, something. Doctor's running 10 minutes late, we'll be with you shortly. And when you click send, you see a little one comes up here. They see that on their waiting screen and they know they haven't been forgotten about and they're waiting, listening to their music, but you can do manual notifications. You can also set up automatic notifications that you type in. And I can't show you that at the moment because I haven't got, that's your clinic administration role that can do that. There's a little configure section here normally for clinic admins, and they can actually set them up to go. After 1 minute, it could say, welcome, please continue to hold and your doctor will be with you shortly. After 5 minutes, sorry for the delay, you know, please continue to hold, enjoy the music, whatever. You can have anything come up. And so they can kind of get those on their screen. You can also configure audio messages. So the music would stop playing for a moment and then you would hear somebody say a message, and that can all be configured in the waiting area. So that's why it's been designed to see patients in this way. And then they only ever need one link. So all the patients get this one link. And if the waiting area is open and they have an appointment at that time, they'll be able to get through like I showed you before. Meeting rooms are designed for team meetings. So any signed in user can enter a meeting room, and then you go into a little video room, and anybody else that you're going to have a meeting with, if they're in your team, they can enter as well. If you have somebody from outside of your team, you can actually invite people into meeting rooms. User rooms are private rooms that only you have access to, and then you can invite people in, and they're really designed for meetings with specialists or someone like that that you don't want anyone else to come into because nobody else can see this enter. So you can use them. They're much more limited functionality. And if you've got a receptionist, for example, saying, oh, what's going on at the moment, or you want to just see what activity is going on, you wouldn't know that there's somebody in that user room because you won't see them in the waiting area. You can also put people on hold in the waiting area. So if I go, I'm back here in my video call. Video's been turned, oh, there we go, there's Nerida. So I'm back in my call. I'll just show you how to end a call. So if I click on the big red button at the top, I can either end the call for everybody, and that means that would end for Nerida as well. And myself, I'd say thanks and I'll see you next time. Because I'm only in a call with one other person, if I leave the call though, a separate functionality, leave call, it'll put Nerida on hold in the waiting area, and then perhaps the receptionist can join them and take a payment, or they could sort out their next appointment, make another appointment. So if you end the call at end for everyone, I'll just leave the call. If I leave the call, it says my session has finished, but Nerida is now there on hold. Somebody else can join her now and go, oh, you know, take payment. That was great. Let's book in your next appointment type thing. So that can be joined by somebody else. So that allows all those workflows in the waiting area. So I would suggest that you don't see your patients in the user rooms, and that in fact we default to having those turned off when we invite people when we're doing it. But it does work, and you can invite people in there. You just don't have the same functionality. So, and then Nerida, you can either leave the call or...
Yes, I will, because I'm having a bit of trouble with my internet and also my phone's about to die. So I'm going to do that. I'm going to leave.
She can leave, and there we go. Then I've got someone else waiting that I could join.
So I actually have some more questions, Jude. I mean, was there anything else you really wanted to cover before we do a bit of some questions?
No,
Some more
look, there's
questions?
lots more that I could cover, but they're the basics of how you use it, and it'd be great to go to some questions, so that's fine.
Sure. And of course, the other thing is that, well, both Healthdirect run lots of different online training, like advanced training and reception training and all sorts of training. I know that they have lots of webinars. And of course, the other thing is if you would like some, if you've got a certain question, I do my best to help people, or I refer them on to Healthdirect, whatever I need to do.
Yeah.
So,
and here's our training
yes.
webinars page as well. So you can see there's our normal ones with clinic admin, service providers, and then there's RACGP, where you can get CPD points for attending. So yeah, we've got a range.
So one of the questions is, can we invite patients directly without going through reception?
Yes.
So that's one of the questions, please.
You can invite however you would like. So you can just send it directly from the platform, as I showed before, and you can just send it out and they'll get that via email or SMS, and it'll include the link. And remember, we've got some templates that you can add in here, or you can just type in what you would like. So you can do that from here, or you can copy the link and send it however you normally would. You don't have to do it. You don't have to integrate it with your practice software. You can send it from here, whatever works for your practice.
Then we've got a couple more questions, particularly around confidentiality. So one of the questions is, would anyone else be able to access information, including Healthdirect? Do they know what the doctor's consultation is about? Is there any, I guess the other question might be, is anything recorded? Is anything kept? So obviously, is there confidentiality?
Completely confidential. We don't know. No, the only people that can see what's going on in your call are the people in your call. Once the call ends, all the patient information is purged. We don't know what the call was about. We don't record anything. That's why it's very different to something like a Zoom or that nobody else can see. The only thing people can see is other people signed in here, like the other doctors, the receptionists. They can just see that people are waiting. They can see when a call is in progress because it'll say being seen and has 2 participants. The only way they could see what was going on in there is to join the call, and you don't join a call with someone that's not your patient, and it's extremely rare that anyone has ever done that by accident, and you can lock the call once you're in it. So confidentiality is really, really important, and it's completely confidential. And we've got, on our resource center, we've also got, if you type in security, we've got a lot of information around that, and it's all about privacy, data sovereignty, scalability, and then it gives a summary of how this is all secure, and goes through with some links to the security manual, which is the government manual. So we've really built this into the platform the whole way through.
Another question, which is an interesting one actually, saying, can we use this function for like more private use? Like, could you contact someone overseas, like a friend or a relative? And I assume that would also mean potentially for a patient's relative. Can we have people from overseas joining in on these?
You can have people from overseas. Not meant to use it if it's not just for your personal use, but yes, you can have people joining from overseas. They just need to put in when they're putting in their phone number, they just need to have the correct country code at that first screen, or in your clinic you can turn off that a phone number is required and they don't have to put it in. Otherwise it might not recognize the phone number if it's an overseas number. But yes, you can have people from overseas. And if you're in, so this is for public health consultations, that's what it's funded for. So just to be aware of that.
Beautiful. And there was another question, similar, well, not similar actually, but around payment and about cost of the service. And I mean, I can definitely answer this one, but I'm sure Jude will join me about, do patients need to pay for this service? No, there's no cost to our patients, to our practices, to anyone. The federal government are very kindly funding all of this, and that also,
yes.
Well, correct me if I'm wrong, Jude, but there's also covers the SMS cost. Is that? I don't see.
Yeah, there's no cost.
Yeah.
Yep.
So even if you're sending the invite by SMS, you don't have a cost of a few cents or whatever for your practice. There's no cost for sending out SMS.
No.
And there, so there's similar questions around, do they need to pay for the video call? I mean, the only thing I guess in terms of a patient, if they're using their mobile phone, it might use some of their data. Would that
That's right. Yes, that's right. It would use some of their data, and it's not huge, but if they watch something like a YouTube video, it's similar to that, because it's basically streaming some video and they're downloading that video. But it shouldn't be a lot. And these days, people often, not everyone, has a lot of data available on their phone, but that's the only cost. As you say, the government does fund this, and it's completely funded. So there's no cost to you or the patient.
Excellent. And I've got another question that, again, maybe it's more for me, I'm not sure, it probably covers both of us, but they're saying that if the rest of their practice isn't interested in doing telehealth videos, can they join as a sole user? Do you have any comment on that?
Look, I'll just stop sharing so you don't have to stare at my screen. Yeah, look, if you say you were a doctor in a practice and your other doctor said, no, I don't want to do it, you could just set up the practice and be put in as the only service provider. Yes. Yeah. As long as you're, covered in the eligibility criteria, that's fine.
Yeah, and I was going to say, I totally agree with that. I mean, we've got some practices that really it's just one GP in the practice feels confident with the video, or for whatever reason decides just one of them will prefer to do it, and that's okay. I still set up that practice as a practice, and one GP is a user, and maybe the admin staff might be a user. I actually have set up another GP, and hopefully this is all right, but she's part of a practice, but she also does some consultations, particularly for her aged care residents. She does them sort of as a sole trader sort of thing, like she sort of does that on her own situation. And she wanted to do telehealth given the outbreak. She didn't want to go into aged care facilities and risk, exposing any residents. So so we set her up her own clinic kind of thing so that she could contact her residents in the aged care facility.
Yeah, and just remember, so for any reporting purposes, any stuff that any calls that go on are seen to be calls with patients in that particular clinic, but you can get set up, say, as a psychologist, because that's covered under our other PHN program, or certain allied health professionals, mental health, aged care is in there, to be able to access video call anyway. So you can be a member of more than one clinic, obviously.
Yeah, absolutely. And there's one question before we totally run out of time. And I think this is a really important one. The question is, if I'm sending the patient the link as an SMS, what information from the practice side is actually provided to the patient? And particularly the question is my mobile number going to be shown? If I'm logged in on my phone and I'm sending out the SMS request to other patients, do they see the doctor or the practice mobile? What do they see?
Okay, so if you say you send it from the platform, is I presume what you're saying. If you send it just from your own SMS, obviously they'll see your phone number, but that's if you send it from your phone using your messaging system, not using the platform. But if you're signed in to video call, even on your phone or on your computer or whatever, and you select send an SMS from that system that I showed you on the right-hand side, share the link to your waiting area, it doesn't come from your phone number. It'll just say HDA, which is Healthdirect Australia, and it'll just show up as HDA. The only way people are ever going to see your phone number is if you copy the link, paste it into a message on your phone, and then send an SMS from your phone, or perhaps the practice managers, like perhaps you've got a practice management phone and you don't mind if people get that number, you could send it from there. If you send it from your own private email address. But if you're sending it from the platform where it says send an email or SMS, it won't show that. An email will show up as sending from do not reply at healthdirect.org.au, and an SMS will show as HDA.
Yes, thank you very much. And I often do remind people that same, and I think you already covered it, Jude, but like even if the GP sets up their own personal account using their personal email, that information is not, that's just for logging in. That's not shared with anybody.
It's just for logging in. Yep.
Yeah.
Absolutely.
Yeah. So, all right. Well, I think we've pretty much used up all of our time. We've covered our questions, and thank you for everyone who has asked some questions. And I'm glad to see a few people have said thank you, that it was helpful. So that's always good. Right. Thank you very much, Jude. We really appreciate you taking the time to help us out in our PHN. And look, you know, it's obviously a bit of a hot topic. If anyone's got any more questions, just email them through to me or to us at telehealth@cespn.com.au. I can follow up or forward on anything I need. And look, I mean, maybe we need to do some more of these, but at the moment they'll all be up on our YouTube as well. Lots of stuff already on the help website from Healthdirect, which is all really useful and quite good small bites of, you know, short videos. So yeah, thank you again. I think you'll get the evaluation come up as we log off, I believe. And if you don't, I'm sure Bertha will send it out to you as well. So we do appreciate your feedback. So please fill those in. That's it. Thanks, everyone. Have a good rest of the day.
Thanks, everyone. Thanks.